With that in mind, it is my pleasure to introduce the Patch program representatives who have joined us today. Are you guys off mute?
We're good.
Yes. You're good? All right. I'm going to hand it over to you two to lead us through some of the information regarding Patch.
Great. I'm going to go ahead and share my screen so you all can see the PowerPoint that we're going to be using. I think we're good. Hi, everyone. Thanks so much for being on the call with us today. We're excited to be invited by Maya. My name is Erica Koepsel. My pronouns are she, her, hers, and I am the Patch Program Manager and Dane County Site Coordinator. We are here to talk to you today about successfully partnering with youth, including a young person I have here next to me, Eliette. So we're going to share some very specific strategies that we use in Patch about including young adult perspectives and teen perspectives to help improve adolescent health outcomes. For those of you who maybe aren't familiar with Patch, it stands for Providers and Teens Communicating for Health. And we're a nonprofit program that really it's teen driven, and we're really working to improve adolescent health outcomes as well as ensure that teens can access services and have access to high quality healthcare services and experiences. You'll be mostly hearing from me today, as well as an amazing adolescent health expert. I already introduced a little bit, Eliette, who's a Patch Teen Educator. Do you want to introduce yourself at all?
Sure. So as Erica said, I'm Eliette Soler. My pronouns are she, her, hers, and I was in Patch for 3 years, and I just graduated, so I'm done now.
Woohoo! So exciting. So Eliette this year was one of the 19 teen educators that Patch hired and employed. Currently, we just wrapped up our program year here in the Madison and Milwaukee teen educator teams. And so they are getting ready to go on to enjoy a summer of not having to work for us all the time. I am so excited to call them my colleagues though, and so thankful to have worked so closely with them and to get to share those experiences with all of you today. You will start out hearing a lot more from me as far as the background and things like that, but we'll leave Letty plenty of time to share her own stories and experiences. I need to figure out how to move this slide forward. There we go. So today we're going to focus on 3 different things.
Sorry.
Letty's helping me out. First thing we're going to do, although I know I'm probably preaching to the choir, you're all doing amazing things to improve adolescent healthcare experiences. I know many of you work in that transition from adolescent to adult-based care. I do still want to take a moment to talk about the need for high-quality adolescent healthcare, and today really why youth voice is so important in those experiences and why that matters to know what they're going through. The next thing we're going to talk about is really the Patch program. I'll describe it for those of you who aren't familiar with Patch, and I'll talk a little bit about how we're currently working towards improving adolescent healthcare, about how we're engaging teens, and really what we're doing here in Wisconsin and across the nation. So some opportunities for replication and partnership, which I hope will be relevant and potentially interesting to some of you here in the room. And then finally, I think the part that most of us are here for today is that we'll talk specifically about ways that we at Patch have been really successful in partnering with young people. And again, because we think at Patch teens are the population that are best equipped to talk about adolescent healthcare, Letty will be really joining in for that part of the presentation and sharing her own experiences with all of you about both, I think, healthcare experiences as well as especially with the Patch program and what's made it possible for her to be involved. As Maya said, we have plenty of time for Q&A. We actually have a pretty short presentation for you. And as you're going, feel free to answer questions or ask questions in the question box. I will make sure we answer them at the end, but Maya's been totally game to interrupt us if something seems really relevant at the time. With that, I think we'll just go ahead and get started. So why are we talking about adolescent healthcare? We know that generally teens are often a population of folks who are considered healthy. So for many individuals we work with, it seems weird that that's the focus population for us. And really, to us, this stage is a critical time when patients are setting the stage for their future healthcare experiences. They're often deciding or exploring during this phase whether they're going to be able to become smart, engaged, educated consumers of the healthcare system, or whether that's not going to be the case. So really, regardless of healthcare needs at that moment, it's important to engage them during this phase so that we're developing those lifelong positive habits and making sure they have the skills when they need them. The other reason we focus a lot on adolescent health is because many of us have seen things like the youth or the YRBS, I'm blanking on what it stands for at the moment, but that surveys and those data that a lot of the unintentional injuries and accidents that are experienced by young people can be prevented, and as part of that preventive care and conversations going on in providers' offices. And so there's a lot of health topics that are really unique to adolescent populations that we think can be prevented and really addressed within the healthcare system. So on top of that, I think the next question folks ask is often, why healthcare? Adolescents get health information from so many different places. I assume you'd agree. And so we focus on healthcare, though, because it really is this huge umbrella, and many teens are interacting with it in some way or another at some point in their adolescence, between well visits, physicals, things like that. There's somebody, school counselors, school nurses, there's somebody that they're probably interacting with at some point. And in addition to that, really access and getting teens involved early, providers can include important preventive immunizations. They can help manage chronic conditions. They can promote healthy behaviors, which is always what we want to start doing early on in life. The other thing is that healthcare professionals really do have this uniquely confidential and safe environment to talk. And the reason that's important is I really want to call our attention to the last 4 things from the previous slide. So I'm backing up here. You've seen this slide already. And just read those 4 things: the unintentional injuries and accidents, the exploration of sexuality and sexual interactions, the mental health and substance abuse, the body image and obesity. These are all major concerns for many young people right now, and they're likely to affect young people uniquely in a different way than it affects adults or other folks that might be interacting with teens. I know I hear a lot about it in conversations with the teen educators. These topics come up a lot, along with many others.
If I may say, I also think it's really helpful to, as a teen, obviously, there are a lot of things going on. And so it's nice to have just another support person who's not only, like you said, can keep things confidential, isn't going to gossip, but it's also someone who, isn't just a random person on the internet or WebMD, your healthcare providers are qualified people who you trust. And I think that is a really useful, really kind of pivotal thing to have. It can really influence a teen.
Yeah, thanks, Letty. Yeah. So a lot of these topics too, there are a lot of places to get access to information, but they can be really sensitive health topics. So it's totally understandable that young people wouldn't want to go to a individual they know to ask about this, but go to the internet instead. And so by helping provide that safe space, they're getting accurate information. One of the things I like to do is just kind of have people throw back to their teen years for a moment. So put yourself back in that 14-year-old body. How many of these issues were on your mind? How often were you talking about these issues with close friends? How often were you talking about these issues with parents or guardians? How awkward was it to talk about some of these issues with parents or guardians when we're talking sexuality, sexual interactions, mental health, substance abuse, body image, and obesity? My guess is that it was probably fairly awkward. I know it was for me, even with very open and welcoming guardians. And would you, I guess Letty kind of got there, but would you have valued a safe and confidential environment to talk about these issues with a very trusted and very knowledgeable source? I see Letty nodding, and that knowledgeable piece I think is really big. Yeah. We all know this, but I just always want people to remember and think back as adults how often we can forget to put ourselves in those teen shoes again, and remember just how complicated life was, just how valuable it might be to have that trusted adult, whether that's you or someone else, to listen to you and that you could ask honest questions of. So we know that those healthcare providers can be important resources. The last thing I want to say here is really that we know those conversations are hard. No matter your level of training, we're not trained in how to be comfortable with these things, and we all have individual things that influence our comfort level. And so Patch exists really to help provide that training and that experience to teens and healthcare providers alike, because we all need to work on it. We all need training and having some of those awkward conversations and having the faith, I think, in our providers and even our teen patients or clients to know that we can have those open and honest conversations. So that's why we're focusing on healthcare, a myriad of reasons, obviously. But the other thing we just want to address is these barriers to appropriate healthcare. So we know teens are facing a lot of challenges. We know healthcare can be a really great resource for them, but we also know that really teens are not receiving the high quality healthcare they need and deserve. They face barriers related to the effectiveness of care, to the quality of care, and really to the satisfaction they receive as teens. And another, kind of stat to throw out there is that more specifically, teens are a population that are least likely to utilize preventive health care. They're also least likely to return for follow-up care, and they're most likely to have a failed patient-provider relationship. And so that one I find really heartbreaking, and it's also understandable because we don't necessarily provide teens all the tools right now to access care in a way that's useful for them. And that's why we exist here at Patch. And so the other things I want to talk about, barriers to appropriate care that are maybe easier to overcome to start, is this reluctance to disclose sensitive information. A lot of teens don't understand confidentiality and where it starts and ends. I feel weird talking about this with you right over my shoulder. I was like, some teens like Letty or peers. There's definitely, I think, from any individual of any age, we don't want other people to know our personal information. And when a provider asks teens personal questions, it might feel like it's none of their business to know that information. And there's this fear of being judged or lectured. Young people get lectured all the time at home and at school and in so many places in their life. And I think there's a fear that it'll happen in a provider's office as well. So all of that really hinders open and honest dialogue between teens and their providers. Could be lying by omission. It could be falsifying information. It could just be not even getting to the conversation in the first place, but it prevents really that quality of healthcare that teens deserve. On top of that, the healthcare system is complex. I think we would all agree to that, especially from a viewpoint of teens who have probably had parents or guardians or an adult take care of a lot of this from, when they were born, really. So when it comes then to making appointments and filling out paperwork and refilling prescriptions and asking questions, there's a lot of uncertainty, and it can be really overwhelming to know where to start. And so when teens then have to do this alone, that might be a huge barrier to even getting them in the clinic in the first place. And that's something that we work on coaching teens through. And finally, the last barrier I just want to talk about is really those specific barriers to access, which I'm sure many of you are familiar with as well, that it might be clinic hours. And if they're open during the school day and you have teens who are in school and then immediately go to work or involved in sports, it might be hard for folks to get there. If folks have insurance or not can be a huge barrier. Transportation to and from the clinic, whether it's on a bus line, whether there's parking, whether it's walkable to where they are. I think there's a lot of those very tangible barriers that make it challenging for teens to come in the first place, or to return for follow-up care can be really challenging as well. Again, I think we all know this, but we just want to make sure that, we realize this is less than ideal. And this is the stage that we want to be setting a positive example. We want to be setting a positive experience so that when they move forward, they have that good relationship with the healthcare system for future healthcare experiences. So with all of that really comes Patch, and brings me to Patch. And I've already mentioned this is a lot of why we exist. So we really do envision a supportive environment in which all adolescents are able to reach their optimal health, safety, and economic security. We are a program of the Wisconsin Alliance for Women's Health. At least the Dane County site is housed there. And so that health, safety, and economic security is really important in that regard. And then our mission is to improve adolescent health and well-being by engaging, educating, and empowering youth and adults as trusted partners in care. And I think really that youth and adults as trusted partners is a lot of what we're going to talk about today as well. I think I promised in this part 2, we're going to talk a little bit about why bringing youth in to address those barriers is so important. And I think it really just comes down to, who else can give the accurate, authentic advice and insight about their experiences. We know that there are barriers to care because teens have told us there are barriers to care. They've filled out evaluations, they've given surveys, they've told us in Patch workshops why it's hard for them to get to the provider's office or trust providers. If we aren't hearing directly from them, it's really impossible for us to know their needs. And I think that's kind of where we're moving forward, and the hope that by engaging teens in the work you're doing, you're able to address some of those barriers to care and improve that relationship between patients and providers, clients, and other caregivers at the same time. So to provide a little more background about PATCH for you all before we really dive into the rest of it, this is our PATCH theory of change. It's a graphic we really like. We think it's really teen friendly and also helps us remember why we're doing the work that we're doing. We understand, like many of you as well, that there are so many areas where adolescent health is directly impacted. You see education, so the information that they're getting in schools or other organizations that they're involved in, they're having education in a variety of different ways, depending on where the young person lives. They're getting values from home. There's clinic-wide, statewide, nationwide policies and practices that influence our ability to help adolescents. So at PATCH, we really do all that we can to impact and improve the impact in all of these areas by harnessing the power of teen voice to make change within these healthcare systems. To those I know many of you on the webinar may come from different backgrounds. Today, I'm hoping the advice really reaches out wherever you are at. You'll see in the very center of this image, we talk about youth-driven, we talk about positive youth development, and we talk about youth advocates. Those youth advocates are a position we actually hire for at PATCH, but also includes the teen educators who are becoming advocates for their own health and well-being. And so that's really where we're going to focus today, is that youth-driven, the central part of the work that we're doing. Letty, do you want to talk a little bit about what a PATCH program year looks like so folks can get the image?
Absolutely. I'll give you a little timeline. So we begin the process of a year kind of at the end of the year. So if that makes any sense at all. So Erica and other teen educators and I will try and recruit people. We'll hang up posters, talk to our friends and family, and tell everyone you know about PATCH. And then the adults will interview and hire new teen educators. And then there's, at the end of the summer, the new PATCH year, the new academic year, there will be training. It usually adds up to about 24 hours of training, and it's split up usually over the span of 2 weeks or so. And then we get into the school year where bi-monthly meetings are required. Those are the enrichment meetings. And there we pretty much learn about all different fun topics that'll improve our advocacy skills and also just enrich us and teach us more about the world around us and give us a broader perspective and really give us things to think about as we're trying to access different groups of people and providers. So we do those enrichment meetings, and then we are also asked to do a minimum of 4 workshops per year, so 1 per quarter. So the workshops are PATCH for providers and PATCH for teens. This year I did 1 PATCH for teens, and then all the rest were PATCH for providers workshops. And those are always a huge blast, a lot of fun. And then the cycle just repeats, and we recruit and hire again. It's a great time.
Yeah, so Letty hit on a great point that I always forget, that it is really geared to their school year. So we train during the daytime before school starts, ideally, so that we're respecting when they get into school. Those first few weeks can be really challenging. We have our meetings in the evening. We'll talk some more about these logistics later, but we have the meetings during the evening throughout the school year. And then we wrap up before the end of the school year, before finals and things like that, knowing that a lot of the teens have different commitments during the summer.
Yeah, and I think that is really important. It's become very clear that PATCH is willing to work around our schedules. You guys have found a good time for us, the end of summer, when summer sports are ending and it's just kind of a new phase, a new year. So I think that works really well too, the timeline of everything.
Yeah, we've gotten there. The other things I want to note about the workshops, I feel like I saw a couple familiar names and some of you have seen workshops, but the teen educators are the ones leading the full workshops, and we'll talk a little bit about that responsibility of it. But really we make them the experts in the room, and then I, as a site coordinator and direct supporter of the teens, am there to support and be an adult representative in the room, but that's their opportunity to really shine. So it's kind of our program year. Feel free to ask questions if there are other things you want to know. these are just some pictures, because I know people like to see the teens we work with, of the 2017-2018 Teen Educator teams. So the top one's Madison, Wisconsin. The bottom one's Milwaukee, Wisconsin. I think we've been hiring, so our programming is very teen-driven and youth-driven, and we've hired teens to be part of our staff for the past 8 years now. Patch started in 2010. We really take great pride in the diversity of our teen educators and really try to hire teams that are reflective of the community where the team is located. Typically, we recommend teams being around 10 to 12 individuals. It allows them plenty of work, but also an ability to connect without it being too large and potentially getting cliquey and all of those things that happen. You'll notice our Milwaukee site is shorter. Milwaukee was an expansion site that happened. Originally, Dane County is our original site. And so Milwaukee wasn't able to hire new teen educators last year, but that group of 7 were continuing on for their second year of programming. Other things that might be helpful to know right now. So these are the 2 teams that are part of the Wisconsin Alliance for Women's Health, but Patch is also growing nationally. So those of you across the state, there's teams coming soon in Wausau and La Crosse, Wisconsin, that'll be launching later this summer, and I can connect you to those folks if you're interested after this and getting involved there. There's also some other statewide places that have launched in Buffalo, New York, in Clinton County, Indiana, and soon in Indianapolis, Indiana as well. So it's growing, and the number of teens who are doing this work is multiplying every year, which is really exciting to see, and I think shows, like all of you being on the call, just how important the youth voice is in making change and improving the future. So the other thing I want to share is that really we do ongoing evaluation of all of the workshops that we already mentioned, as well as the teen educators. And having that ability to have authentic insight and experiences from the teens shared with us has allowed us to continue to grow and develop into this model that we're going to share with you today. And really kind of our strategies for engaging youth were born out of working with youth and learning from the youth as we did this year from year to year. So what I'm going to talk with you about today, specifically moving forward, and the strategies that we use, is this teen educator model is what we call it. We work with other groups of young people that kind of are within that same model with us. And really we have this model because we think there are 4 things we do uniquely well here at Patch. And I was chatting with Eliette before this, and it was exciting to hear her be like, yes, I've seen all of those. And so she'll talk to us too about what that's meant for her and how she's observed it. But the first thing that we do, I'll give a brief overview of each, and then we'll dive into a little bit more. But we are based in an employment model. You've heard both of us say we interview, we hire, it's a job. They go through a fairly intensive process before they're brought onto the team and are paid for the time that they spend with the program. And it really does provide a valuable workforce development opportunity for them, and also keeps teen educators engaged, allows Patch to be a priority in their life. We know that's often a thing that folks struggle when engaging youth, is how to have them prioritize the work that they're doing there. And we know having it be a job has helped a lot with that. And it also, I think the biggest thing for us is that it shows them that their voice matters, that we want them engaged, and that we value their time enough to compensate it for them. So that's kind of the first component of our model. The next part of it is really this training model. And so teen educators in Dane County go through a set 24-hour training. Other sites do a 20-hour training that we have helped them develop at the very beginning of the program year. And as Eliette already said, they experience ongoing enrichment throughout the year to help them learn and grow in their role as a teen educator, but also, as we were talking, Eliette was saying, just as a human, like just to live life as a human, we provide them those skills and those tools. While some of that training is fixed, there's certain things we talk about every year. The teen educators do have the opportunity to provide insight and suggested topics for training or for enrichment based on what they want to learn, based on what's currently going on in the world. And so we have a fairly fixed curriculum, but we do take that teen input, and we realize that from year to year, the priorities are going to change based on the youth that we're working with, based on the world around them. The other thing is that we really boast a powerful empowerment model. And so I already said teens are trained to be the sole facilitators of our Patch workshops. They are the experts at being teens. We make sure that they know that they are the experts, and we make sure that the people in the room know that it's the teens they should be asking questions of and not the staff. They're also given the opportunity to stand up in front of their peers and to act as really these very knowledgeable sources for other people in their schools and their communities at their other jobs. And we set high expectations for them within that to be advocates on their own, to find something they're passionate about. It doesn't have to be Patch all the time, but other ways that they can then go out into the world, and we provide them the support they need for those advocacy opportunities. And the last thing, just like an overview, the youth-adult relationship is a really important part to us, or to our work. You'll notice that we say that we're a youth-driven program, so we're not necessarily youth-led. So the staff involved in that can be really, really important. We are very deliberate and very confident in our youth-adult relationship model, which is really based on those foundations of trust and respect, which is also what our Patch for Providers workshops are focused on, and really building a relationship with teens, between teens and adults. We are clear about boundaries and are transparent about program goals. We treat the teen educators as colleagues. That's why Letty's here with me on this call. I think it's important to have that perspective. And we encourage their voices in program improvements, and we get that from them every year, and then, sit down even verbally and encourage them to tell us more as they go. I think all of these really give us this opportunity to walk the walk, to show teens how important their work is. I think the other thing, we're going to talk about why the model works, sharing those strategies again, but the other thing for you all to know that might be interesting is that we are currently evaluating this Teen Educator Model to learn a little bit more about how it works, how it impacts the teens. They fill out an end of the year survey every year, but also Teen Educator alumni have been interviewed to learn more about their experience and how Patch has influenced them even outside of that. So much background information. We're gonna dive into some of the nitty-gritty specifically related to this. I've already mentioned the employment model. We do have a unique ability to hire and pay teen educators. We know that the ability to hire and pay is not always there for everyone else, but thinking about other ways that you might be able to compensate teens can be really helpful in that process. The other thing that unique ability allows us to do, though, is that we can interview teen educators. We can provide them that workforce development skill, but we can also screen folks, not because we don't want them involved, but to find the voices that are going to complement one another, that are going to get the right people at the table to really create lasting change. When we interview them, we really look for and consider probably not things that are typically included in interviews. We don't necessarily need a perfect track previous work experience. We're looking for that passion and for related life experiences. When I work with my supervisor on interviews, we call it a spark that we think that we can see in these young people, where they're willing and ready to learn and have something really important to bring to the table. We also look a lot at folks who maybe haven't been given this opportunity before. So it's not the same person who's in 5, 10, 20 different clubs, but it's someone who wants to dedicate their time to something and is still trying to be given that opportunity to be involved. The other thing we look at is individuality. We want them to apply because they are interested in doing the work, not because someone else in their life is like, you want to do this work. And not necessarily because their friends are doing it either. We actually try really hard not to hire friends, to have people on the team that are going to be coming from different backgrounds and unique identities that might not have things in common, because building this team of folks who are different than one another and aren't always the shining stars can be really reflective of the communities around us and reflective of their experiences, of the community at large, and allows them to learn from one another at the same time. And so we're really intentional about building that team. When we interview, it also allows us to gauge our own capacity. We know that there are teens that need way more support than others, and we know that there are teens that are always going to be there and are dedicated and have a way to get from place to place. And so as staff members and employees at Patch, we are really aware of our own capacity when dealing with unique challenges for participation. So like transportation, the support from family members or home life, mental health, other health things that might allow them to participate some days and not others, so that we have enough voices on the team to represent at workshops throughout the year, at enrichment meetings, and all of those things. So that interview process can be really powerful. And I think it's a really good experience. So even folks who would welcome in any teen who comes, we obviously have a limited number of spots because we pay teens and we want to give them enough work throughout the year through the workshops that we do, that I think just doing an interview and setting them down, whether it's a group interview session, and hearing why they want to be involved and having them think critically about that can be really powerful and can maybe help folks realize why they're there in the first place. We also have them fill out an application. Mostly that helps us have concrete information on how to contact them, on things they like and don't like. It allows us to see if they've grown and to talk with them about their passions early on in that process. The other thing, I think I already talked about, this kind of us setting an example, is that we treat teens like adults. We have a job, we set expectations for them, we expect them to be there, we communicate with them like they're going to be there, and we treat Patch like a job, including a job description and everything else. So they sign a contract with us, they know what's expected of them. So in that case, we also do that workforce development thing. So professional expectations, I say professional in that we're very comfortable as an organization, we're very informal as an organization, but we have high communication expectations, for example, is one of the biggest things. We introduce them to the functioning of nonprofits. So we are a very small nonprofit. All of our staff members, I think, come in and interact with the teens in some capacity or another. Our office is often open to them. So we figure out ways to let them see the inner workings of this organization that they work for as well, which can be really powerful. It provides them an opportunity to work with and interact with adults in a professional capacity and as a colleague. So that's us as colleagues, but that's also through workshops. They're there as a representative of Patch. They're shaking hands, they're greeting people. They are colleagues with the people in the room, sharing their expertise on a topic that these other folks also are learning about. It allows us to also respect their time outside of Patch. We know that there are lives outside of Patch. And so by making it a job, we respect their time. When they are here, it is on the clock, it's Patch time. And when they aren't here, they're living their lives. And we connect with them as needed, but also let them do their things outside of Patch. And then I think I already mentioned, we have them sign a contract dedicating to the work. So we do try to make it as much of a job as we can, showing them how much we respect them. And also, I think, providing a way for them to be involved. Letty, do you want to talk, what part of this being a job have you benefited from? And what has that meant to you to have this be a job where you're paid and you're expected to be here and all that?
Yeah, so obviously money really helps. It's nice to have and it feels good to earn, but it also, kind of going back to like the structure of our team and diversity, it gives us the opportunity to welcome youths who cannot or maybe don't have the opportunity to not work, you know, if they need to support their family for whatever reason, or just need to make money. So that makes it a lot more accessible to teens of all different backgrounds. It also has felt like kind of a safe first job, you know what I mean? Like, it's like Erica was talking about, we develop skills and we learn how to be professional, but it's also a place that is designed for teens. And there's a lot of room for error, you know, like it's okay if I don't have a ride for the workshop because there have been plans that that are put in place so that I can get a ride. You know what I mean? Like it's a space that's designed for teens, and I think that has made it comfortable and a comfortable place to learn and grow and make mistakes and all the good stuff. And what's kept me coming back is the empowerment and passion that is present in Patch. It's made it exciting and a place that I want to be in. It's a job that I enjoy, which is really exciting. I feel like we hear a lot about like, oh, work is the worst thing ever, like don't ever grow up, but Patch is really exciting, and it shows us that there can be passion in employment. And also just working with the people that are in Patch is really fantastic. You know, having such an incredible boss like Erica, that really helps. It's the workforce development is really quite outstanding. I feel like I've learned how to have a professional relationship with a manager and coworkers while also maintaining rapport and understanding, you know, how can we trust each other and support each other while maintaining this work environment, which I think has been really good.
Thanks, Letty. The other thing I think too, listening to Letty talk, was that I didn't mention is this, having it have a job provides a structure to the teens and allows them to know that this is a job. This is a space that has been created for them. It's a structure that's been created for them, and they know what to expect. And I think that makes it potentially safe as a first job. They're not going to walk in and be like, what's going to happen today? I have no idea. It's very structured. It's very much meeting them where they're at. And I think the point about allowing teens to stay engaged because they're being paid is really important and poignant, because we have had teen educators in the past who have had less supportive home lives and who have had to drop out of every extracurricular activity except Patch, because Patch was a job and Patch wasn't a club. And so I think that ability to stay engaged, whether it's they don't have transportation until we help them figure that out so that it's not like they're going to get fired, we're just going to work through it, or that they wouldn't be able to be engaged in something else, but they are here because it's a job. So that's why they keep coming back. And it might be that it takes them a while to get used to the space, but we pay them, they get here. I think that structure is really helpful. And so I guess my main takeaway from here is, even if you can't pay them, again, I know that's a huge barrier for folks, provide them that structure. Find a way to compensate, whether that is through gift cards, for example, that can be donated by community organizations, whether that's through smaller stipends that aren't necessarily paid hourly. I guess folks maybe are interested in how much our teen educators make, but we do pay for training, which is 20 to 24 hours. We pay a stipend of $100. We realize it's not a great hourly rate, but we also recognize our challenges as a small nonprofit to pay everyone hourly for the 24 hours of training would be a lot more difficult for us than that stipend. So we pay a stipend to start. And then throughout the year, we pay $10 per hour. Eliette mentioned the enrichment meetings. We have 2 every month, typically every other week. They are 2 hours at a time. So if a teen is only participating in enrichment meetings, they're making $40 a month max. And that's not necessarily a lot out of our budget, but it does go a long way to help keep teens engaged. And many months there's the opportunity for them to make $110 because they did 3, 4, 5 workshops if they were free and available to do that as well. And so that hourly rate, it feels hard to kind of jump that hoop to begin paying them, but it ends up not being too much because they're not here full time. They're here the hours that they can be here.
Yeah, and one thing I forgot to mention, I've used Patch as a job reference, which is really cool. Being 15 years old and being able to say that I worked for a nonprofit organization and I have a bunch of professional contacts that I can use as references. That's really helpful. That's really, that's been really good.
We write
really
so many letters of rec. It's amazing. And it's always fun to be a reference.
Yeah, for college and for other jobs, everything you can think of, the Patch staff is always willing to support us and help us move forward. So
yay. And I think one of the things I've mentioned several times in the other part of our model that can be really important is that training model. So we've already talked about physical space and structure. I should have a picture of our space on here, and I sadly do not. Our space is very much set up like a living room. It's very cozy. It's very comfortable. It's a space that I enjoy working in when I'm in the office on my own during the day, even without the teens. So we make it comfortable. We also make sure that almost all of our events, with the exception of workshops, all of their training and learning events are in the same space. Even their interview actually is in the same space in an adjacent conference room to our living room space. But we make sure that they know where they're going every time that they're going. We make sure that they develop a comfort in this physical space. Our space actually changed last program year, halfway through the year, and that change in space totally changed the vibe of our group meeting. The first 2 or 3 times we were here, I know leading the group, it was off. It wasn't working because they had gotten so used to meeting somewhere else, and then having that sudden change in their home was hard. And so being able to provide this space and structure throughout training and hiring and all of that can be really important. But I also think the training model is important because we also don't expect teens to come in with all the knowledge that they need. We said we look for that spark, and then we provide them through training all the things that they're going to need. So the teen educator training it's a 20 to 24 hour training. We do it 4 hours a day over 2 different weekends. And we've done this because having 8-hour days, we learned, is really hard on the brain, on the body, on the heart. And so we needed to split it up for them to be able to also work other jobs, to spend time with family, to do homework for those who are in summer classes. And so we found this perfect, it's been 8 years, and I think it took us 5 years to find the model that works best for them. Splitting it over 2 weekends has been really helpful. I know we did every other weekend, or we did 2 weekends with 1 in between. And I think even Letty was one of the most vocal proponents that was like, that doesn't work for me. I miss being there. I want to be there 2 weekends back to back. And so we've ebbed and flowed, and we found a pretty good model that we do 1 evening on a Thursday or Friday for 4 hours to set the tone. And there's certain training activities that are most appropriate for that evening time of day. And then we do our others on a Saturday and Sunday morning from 9 to 1. We had other sites who have done a noon to 4 training. It depends on their community and what their needs are. But those 4-hour days have been really important. We also do a lot of, during training, the setting the space and resetting the space and resetting the space. So we do a lot of bonding over a common goal, not a common identity. Like I said, we're hiring a group of teen educators who come from a lot of different backgrounds. We try not to hire teens who are friends, although the picture here is actually Eliette, who's there, and Oliver, who is her brother. And so we've had those come through before where people do know each other in advance and people do get really close or come in really close. But we have folks bond over this common goal. And they're all here for the same reason, to improve adolescent healthcare experiences, to talk about things, I think is huge. Everyone who comes here wants to have a good conversation about the world around us. We do a lot of bonding over those differences through activities that encourage discussion, self-reflection, and challenging the norms, because we have a lot of social norms that make it hard to have conversations. So we do a walk and talk icebreaker where teen educators in pairs are given a statement and they're just sent to walk around the block or around the building and to talk about it, to listen to the other person's perspectives and to share their own perspectives. And a lot of those statements are actually pretty values-based, which is why it's done in pairs and they get to chat. And then they change pairs, they change topics, and they get to talk about something else. So it's a way to connect one-on-one. We do some large group team building. We call it Enter the Circle. It's similar in nature to a values walk, where they self-disclose parts of their identity that they choose to share. It's not something folks have to participate in. They can stand in the circle and never step in if they choose to, but it's a way to bond, but it's also happens so rapidly that no one is singled out and no one is felt to be alone. So that's been a great bonding opportunity for us. And then even basic icebreakers, as silly as they are, and I know as much as many of us adults dislike icebreakers, even some of the teens are like, I hate that we're doing this again. But it can be really powerful and provide this foundation to bond with each other while also searching for some uniqueness in ourselves and in our stories.
Mm-hmm.
Did you have something to add? I thought I heard something.
I was just gonna say about the values walk and whatnot. I feel like, I don't know, a little bit going back, because the teams are interviewed and like Erica was talking about, part of the interviewing process is making sure that all of our voices mesh well. I think that something that makes the space really safe and gives us the opportunity to be vulnerable is knowing that I am among a group of my peers who are relatively like-minded and that they're not going to judge me for whatever I'm going to say. You know, like it's a space where it's okay for me to make a mistake. It's okay for me to learn. And so talking about topics that we may not agree on, whatever they may be, it's a breath of fresh air to be in a space knowing that you're not going to be criticized for what you say.
Yeah, I think we try really hard to set the individual space for teens to be there for who they are as a human. We are all amazing people with amazing voices and amazing stories, and a lot of teens aren't provided that opportunity. So that's really our goal. And Letty hasn't even seen my notes, but it really is those opportunities for vulnerability and strength at the same time that we aren't often given. I know one thing we really like to do, and that I actually, when I coach other patch sites, we talk a lot about is roses, thorns, and buds. So sharing something that's going really well, sharing something that's maybe going really crappy, and sharing something we're looking forward to, acknowledging that we all come into this space each day in a different way. And different from the person we were yesterday. And so that setting of the space and that resetting of the space is a big part of training, where we set that and then we do that throughout the time through other team bonding activities at the beginning of every enrichment. And sometimes it's silly. It's a question of the day, like, what crown would you eat if you had to eat a crown, which is not necessarily a great learning opportunity, but it's a way to be fun and to think outside of the box and enjoy one another's company.
Yeah. And I will say, I know we're going to talk about the empowerment model a little bit later, but I do think that having that safe space also adds to the feeling of empowerment and confidence that is required for this job, to speak so publicly and whatnot.
Yeah. And I think I'm glad that Letty took us there, because the other thing we do obviously during training is train them. So it is a lot about team bonding, but it's also about just providing them the tools to tell stories. We have a whole really 1.5 to 2 hour long session where we tell each other stories. We listen to stories and we learn how to tell an engaging story. We practice communication. We learn communication styles, knowing that we do all communicate differently from one another. That impacts our work, that impacts our personal lives. We've used love languages in the past, which is a quiz available online. We've used the color communication. This past year, we had someone come in and do a bystander intervention training that was really looking at that style of communication related to how you address conflict. And so we've done different communication things and provided them the tools to do that. We also obviously build presentation skills. Teen educators are hired to learn, but they're also hired to share knowledge with healthcare professionals and their peers. So we spend the whole second weekend is really on how to present, what the topics are that we're presenting on. They practice using a script, which we do give them a script to use. They practice filling in their own stories in the script. They practice changing of voices, being big, being engaging. And they all find their own voice within that. We don't want them to all present the same way, but we talk about good presentation styles and ways to engage audiences. I think the other thing is that we also train them both during training and empowerment on health topics. We make them, I don't know the right word, but we help them be more comfortable with health topics that can be really hard to talk about. So we talk about sexual health out loud, we talk about mental health out loud, and we do this all very early on in the process. So they're getting to know each other and they're getting to know the topics all at the same time and in a safe space. The other things during that is enrichment. We've mentioned several times, and these topics really provide tools and outlets for them to use their spark, to think about the world around them from a different perspective. Both of these enrichment meetings and trainings do have a curriculum, like I said, but it is flexible. So we always talk about those health topics that are often talked about in health courses with more in depth, with differing perspectives and views and things like that. And we bring in different speakers every year as often as we can to deliver that content. We also try to make sure that teens have control over the topic and ultimately direct the conversation. I know this year, they requested an enrichment on immigration, I think was one that we were able to deliver this year that was requested by the teens to learn about immigration and the immigration system. A few years ago, it was disability and healthcare, and a few years, in between there somewhere was human trafficking. So things that are important to them. I know mass incarceration and school to prison pipelines is something that they want to learn about. And they're not all direct health topics, but they all influence health and interact with health and intersect with health. Mm-hmm. The other thing we really try to do is make them relevant, make them engaging, and make them useful to their daily lives. We want it to be something that they can leave Patch and still use that information. So you'll see that on the slide that says, as opposed to fun. We certainly have a cozy space, but we don't go over the top to make their workshops fun. I think a couple enrichment meetings we had ago, someone was drawing like brains and teaching biology, and it was like being in school, but in a way that was engaging them differently. And so it's not always going to be the most fun, but it's always going to be useful to them. It's always going to be engaging in some capacity or another. And I do think that's huge for it to apply to both their work in Patch and their life outside. I think another one we've done recently has been like financial literacy, how to balance bank accounts and things like that, which might not sound that exciting, but at least is a skill that will help them later on down the road. And when we talk about guest speakers coming in, I'm actually not an expert at all of these topics. So we actually bring in folks from the community that are also representative of the community and that reflect the identities of the teen educators, to engage them and educate them and empower them to talk about these topics. We actually have a form that I'd be happy to share pieces of, where we talk through expectations of the guest speaker. We talk through with them what the presentation is supposed to look like. It should always involve an engaging conversation and activity, things like that. And so we have expectations for our guest speakers, which I think also helps keep enrichment meetings exciting. It gets the right folks in our space. And we also don't always do that perfectly. So we work with the teens when we don't do it perfectly to find a way to fix it, find a way to do it better in the future and move forward that way. I think that's it. I think scheduling is the only thing we've talked about. And again, it's having that structured expectation that they're going to be somewhere at the same time, the same days of the week is really important. So we're not switching from Tuesdays to Wednesdays to Mondays. We need them to know when they're supposed to be here so that their other things don't conflict with that. And so that's a big part of our training, is all of that. And that's a lot. Letty, how do you think training helped you with your role as a teen educator?
Well, obviously it gave me the skills that I needed to properly facilitate a workshop. So I learned how to be charismatic and engage an entire audience of grown-ups who are terrifying. I learned that, and that was really exciting. But it also taught me what was expected of me in terms of the job, and also what types of relationships I need to have with my peers. You know, I didn't know coming into Patch, I didn't know that it would be such a team sport, but it is. You know, we have to learn how to support each individual teen educator. So that was kind of a shock, but it was a nice surprise. It was a pleasant surprise. So I learned how to do that, how to be a team player. And it was also nice to have returning teen educators trained with the new teen educators. I learned a lot from them, you know, having those role models in the space who know what they're doing. It was really nice to have them around. And also, as a returning teen educator for 2 years, I was able to see like the growth in my peers. So coming in on the first day versus the certificate ceremony at the end of training, and just watching them evolve as teen educators and people, and watching their confidence grow throughout the 2 weekends, that was really exciting. Let's see what else. My notes are really messed up.
You're fine. The other question I had, what pieces of training or enrichment have carried over into other areas of your life?
Oh, sure. So going back to the workforce development, I learned how to be professional. And I learned what was expected of me in a job-like environment. Really quick, I did also forget to mention a little bit, I was going to butt in, but about the schedule that Erica was talking about, we are at the beginning of the enrichment, or at the training, we're given a schedule with all the topics. So it's really nice knowing, like, on Tuesday we're going to come in and we're going to talk about this really heavy topic and eat bagels. And so I'm prepared. I have an empty stomach ready for the bagels, and I have an open mind ready for this conversation. So that was also really, really helpful. But yeah, the training is also a really great time for team building, as you talked about. The adults in the program really encouraged us to bond outside of Patch. And this was kind of an opportunity for returning teens to take a leadership role among our peers. So I remember in the beginning of last year, I believe, or maybe both years, I don't quite remember, we had a returning teen educators meeting, and we all got to decide like what our job was going to be. So like mine was to help new people feel welcome and help them kind of fuse in with the space and evolve the space so that they felt welcome and comfortable. So, and it's also because that it's the weekend, and it's 2 weekends, and it's like Friday, Saturday, Sunday, it also gives us time to hang out. Like, I remember my first year, we had a sleepover the night before our last training day, and that was really fun. That was a blast. So I think,
and that was self-organized by them, not even us as a staff.
Yeah, and you guys encouraged us to have a group chat, which is always a blast. It's always so much fun. It's like I'm in a book club. There's just so much conversation going on. So yeah, I think the training is a really good way. It's kind of like boot camp in a way. And so I think it's a fantastic way to set the space and set the tone for the rest of the year.
And I think one of the other things I hear often working with teens is the enrichment topics themselves do carry on to their daily lives. We have teens that have learned about STIs, and so they've helped their peers get tested. We've had teens that, I'm trying to think what it was, but I have teens tell me that, like, we had this great conversation at lunch with my peers because I learned about this in Patch and I took it into the world around me. So again, making that useful for them. I want the main takeaway here. I also don't have a clock on my computer right now because my screen is taken over and I think the clock in our room is wrong. So my main takeaway here on this training model is really we don't expect them to come in with all the skills necessary. And we want them to walk away with more knowledge than they came in with. Because if they're not using that knowledge out in the world, we're not serving them. The other thing I'm just going to flip through quickly so that folks can see is this, our empowerment model is basically that we give them opportunities outside of this Patch space to use their knowledge, and we empower them to go into the world and be leaders in their friend groups, use their advocacy opportunities, and be involved in workshops. We encourage them to get registered to vote. Like, any place that they can advocate, we encourage that, and that can be a really important piece of this. And it's really influencing those future advocates. And then the last thing that I'm going to get to, and I encourage folks to reach out to me via email. I'm so sorry, I lost track of time. I should have clearly worn a watch. Is that we work really hard to build both personal and professional relationships with them. We think it's important to share our personal lives and experiences with them. Also realizing that developing boundaries is really important at the same time, identifying where our mandated reporting requirements are, what we need to do for them to take care of them, but also what we can do to respect their confidentiality and privacy here in this space is huge. It's, I think, the part that makes our work the most effective because we work collaboratively.
So my one question for Letty before we're logging off is, I love that I got to see some pictures, and I think you were in quite a few of them. And I've gotten the opportunity to watch you grow throughout your time in the Patch program too. And so you talk about this this initial starting off and maybe being unsure and then kind of growing into the position and feeling like you found your voice. For some of our providers, they're only having one teen on their group, maybe one person who's able to provide that time and to be there in that dedicated way. What would be your advice to those providers that maybe can't have a group of teens there to build on each other for support? What would be your recommendation for them for kind of making them feel comfortable, making them feel like they're part of the team and that their voice matters?
I think that the youth and adult relationships could be really useful. Being treated like an adult, like a human being, that's really helpful. Also providing the support, you know, like being treated like an adult, but also having the understanding that I'm not really an adult. Like I'm an adult, but I'm not a grown up, you know what I mean? That can be really helpful. I think it's, a lot of it would be about setting the space and making the teen feel comfortable and safe to make mistakes. So just being relatively flexible and understanding. I think that, yeah, I think it's really just about creating a relationship that has mutual respect, and also just an understanding that it's okay to make mistakes and it's okay to be kind of weird and unsure of yourself sometimes. I think that would be really helpful.
Great. And Erica, one question that I have for you. I know you mentioned this, and I think it's just something I wanted to reiterate and kind of get your feedback on too, is that this was a process for Patch. So this didn't turn out, these models were kind of built over these 8 years of this happening, you know, and not to build or talk about your epic failures or things like that, but just, you know, what was that learning process, that learning curve? Where did you finally start to feel, how much time did it take before you started to feel like this, we've got this?
So I got lucky in that I didn't start the program. My supervisor did 8 years ago. And so I've seen her trial and error. But I think we learned, you know, even my first year, it was like, how do I relate? How much of myself do I share? How much of teens how much do I ask of them to share? And I know my whole first year, I was like, what am I doing? And are we doing it okay? And are we getting there? I think a lot of it too, it wasn't until I think maybe a year and a half ago that the Patch program as a whole was able to put language to these things. So you see this model that's laid out beautifully, that's our employment and our empowerment and our training and our youth adult relationships. And a lot of that was happening informally, but it took us a long time to figure out what it was about those things that made it unique. And so I know, like, the thing that started from the beginning was that we paid people and we did the youth adult relationship thing. Those were kind of the first two things that were rooted in there that we owned. The empowerment model, we realized as we went, came with that. And that actually isn't something that takes a lot of work on our end. It's just something that we're like, oh, this is really cool, and we want to continue to support you in your life outside of Patch. That also is that youth adult relationship piece. That came over time. And then really our training approach has been the piece that's been the most transitional. I think Letty's even seen it change every year. The past 3 years, the structure's changed, the days, the times. We've added in a tour day. Like we're continuing to flow and ebb and get better at this. That foundation of the youth adult relationship, the valuing of voices, was step one. And I think from there, the other things tended to flow, and we still don't have it perfect. I'll also say there are teens that we do lose contact with because we can't accommodate them the way that they need. We can't offer as much support as we would like. I personally, as a staff, didn't have the skills to support them how they had. And so there's that learning and growth opportunity there. The other thing I'll say that was our biggest challenge, both myself and my supervisor, and that we're still learning, is this establishing boundaries. We're a small nonprofit. We want to be able to do everything for these wonderful young people who give us their time and their voices and lend us that expertise. But we also had to realize early on that we weren't everything. And so we had to find ways to connect them to other resources, to take care of ourselves as adults in this space while we also took care of the young people. And so we've been working on that as well. And so the training piece has been the one that's been the most in flux. Ooh, somebody's turning off our lights. Hello? Oh, okay.
They're cutting you off.
They're saying we're done. But yeah, so I think that that's the biggest part of it. It's been in a flow. I think prioritizing youth voices has always been day one, and then that relationship piece has always been day one, and everything else ebbs and flows from there. Does that answer your question?
It does. Are there any questions from anyone who's out in the webinar world who would like to have those addressed before we end? Seeing none at this time, I would just remind people that the chat box has the evaluation link in it, and we will be sending that out via the listserv after the presentation. Again, thank you very much to Patch for your presentation and your time. I understand this was over your lunch hour. Thank you again to all who have joined, and this completes this month's learning community. We will be doing our next learning community later in the year, and you'll see an email regarding dates, times, and details about that. Thank you for all who have joined, and this completes the webinar.
Thanks, bye.
Thank you.
Bye.